Hello, everyone, and welcome to the Biohacking Beauty Podcast. My guest today is a doctor that I've been following for, I want to say, for the last 3 or 4 years, and really is, as far as I'm concerned, is one of the people who interest me the most as far as digestion of medical and anti-aging information. His name is Dr. Neil Paulvin. And please, Neil, introduce yourselves. Tell us a little bit about you and what you are doing.
Sure, thanks. Yeah, I am a physician based in Manhattan, and I do treat a lot of patients throughout the country. I treat a lot of athletes and executives who are looking for a lot of different things. I mean, the main focus of the practice is mostly helping patients with anti-aging, longevity, improving performance. That could be everything from peptides to IVs to lab optimization, hormone optimization. But unfortunately, part of that's also dealing with helping treat their illnesses as well to help them be better. So I do have probably about a third of my practice, which is helping patients use both traditional and non-traditional medications, injections, supplements. I love playing with the newest technology. I think same as you in terms of helping patients deal with things, everything from gut health like IBS or Crohn's to I have a lot of patients who have fibromyalgia, Lyme disease, and like the brain fog type patients. So my overarching part of my practice is taking a combination of a little bit traditional, a lot of holistic, a lot of the cool technology that's out there and putting into one combination for my patients to be at their best.
And that's I think in your case, it's pretty self-explanatory why you're a guest in this podcast. But we can draw from what you're saying, and also from the substance of this podcast, is that the podcast is called Biohacking Beauty, not necessarily because we want to talk about creams all day. It's really to relay the fact that we need to take care of our overall health and aim for longevity if our aim is also external beauty and wellness. And as I said, in your case, it's kind of self-explanatory, but it's interesting that you mentioned that you're also called in the end to treat your patients' diseases, because I think a conclusion most of the time would be that if you really dug down to what bothers person, what the person needs to deal with, you're in the end a culprit of it almost always would be the fact that they are aging. Would you agree with that?
Yes, I mean definitely aging. I mean aging. There's now a whole momentum here to get aging qualified as a disease. It's technically not, but yeah, definitely health is affected by aging and vice versa. So there's definitely things that you can do both in health and for illness that if you treat the quote unquote aging model, that you'll improve your life.
Yeah, and again, as you said, the reason I follow religiously your posts and the things that you put out there is because you're really on top of whatever is latest and greatest as far as longevity medicine, anti-aging, etc. So maybe we can start this podcast by really talking about how does treating or aiming for anti-aging and longevity look in your practice? What are some of the things that you find yourself recommend a lot? What are some of the treatments that you like to play around with and recommend?
I mean, there's a two-part answer, and part of it's the boring part of the answer, and part of it's the cool stuff that everybody likes. I mean, no matter what, it's like I tell my patients, that it's still the foundation. Lifestyle is a house, and you still got to build the foundation. So we're still doing the lab work. I may do more detailed, more advanced lab work than the average person. Most people aren't doing testing for mitochondrial health, which is becoming huge now, or you looking at the at NAD levels or so on. But it's looking at those advanced markers that we know kind of are much more helpful in looking at general health. And then it's again working with them on sleep and exercise. I mean, now the cool part of that's where the wearables have come in, and a couple of things I'll talk about in a second. And then obviously maximizing your workout and so on, and diet is always a part of it too. But then the cool new stuff that's kind of that I'm using, we both share a love for NAD, which NAD has a lot of. Now, what's great is it's not just, you don't automatically have to sit there for a 5-hour IV and deal with it. There's so many different formations. I mean, everything from skincare to IV to patches to nose sprays. There's now it's, again, we could debate all day which one's the best for each thing, and that's a whole thing by itself. But I mean, that's one thing. I'm also a huge fan of a product called Spermanding, which, if the people, one of the big tenets now with the anti-aging is the 9 hallmarks of anti-aging. And what's cool is this Spermanding, depending how you want to play it, actually hits about 7 of those, which is the most of any substance out there at all. So that's something which is great because it's a pill, and people still don't like the idea of injecting themselves, who don't want to sit for an IV. So something that they can take in the comfort of their own home is really cool. And the other big part is, people who follow me or see me on social media or read my stuff, is I'm still a peptide junkie. Peptides are small groups of amino acids that make up small proteins. They work on things from enzymes or hormones, or work on some type of organ system to treat everything from, well, not treat, I don't say treat, but can help improve everything from from inflammation to recovery, to sleep, to brain fog, to erectile dysfunction now. So what's great about them is they run the gamut on what they can treat. And now it's a cool offshoot of those, which getting a little more press, something called a bioregulator, which started in Russia. And they have maybe have more potential than peptides because of, we can prescribe them longer and they're a little more specific in how they work. So those are going to be things that are coming down the pike. But there's there's so much cool stuff out there now that we could do, again, I could talk what's new all day. I know you were just at a conference and everybody's showing everything, and it's really a brand new world for it, that people are concentrating on their health and longevity as opposed to treating themselves after they get sick. So the paradigm is hopefully kind of flipping, but it's like changing. It's like sometimes it's like moving the Titanic. It's not going to be something that's going to happen overnight. So
100%. So you really covered a lot there, and you did mention the hallmarks of aging. So really, when we're looking to maybe create a change in someone as far as how they age, what are some of the things that we're looking to change? What's going on there as far as the reasons that they age, and what can we change about it?
Yeah, there's a long list. Right now, as I mentioned, one of my other interests now is the mitochondrial health, and we know now there's numerous components of the mitochondria. The mitochondria, for those who don't know, is the energy part of the cell. It's the battery of the cell, but it does a lot of other things. It helps with detoxification. It helps get rid of the bad DNA. It's kind of like the good and bad egg counter type of situation. Helps with inflammation. Helps with producing some hormones and enzymes that we need for other functions. So working on the different factors of mitochondria, that's why what's great, and there's so many different things out there. We know things like some things that are simple, like cold immersion or fasting works on that, or you can get a 5-hour NAD IV. They both work. So that's one thing that we're definitely looking at. We're looking at, which is kind of in the early stages, we're looking at stem cells, which we have heard, people may have heard it for injections or IV. That's coming. We're still learning more and more every day. And a lot of that also depends on where you're located. Fortunately or unfortunately, there's different laws in every area, what you can and can't do. We're looking at inflammation. Inflammation is the harbinger for a lot of different types of illnesses, everything from heart disease to Alzheimer's to obesity. We know that's definitely, so those are things that we're looking at. We're looking at now, we know more from a lot of the cool research out there, that circadian rhythm, the pattern that you develop every day, your body, we know that your body, including we always thought it was more like sleep cycle. We now know your digestion cycle works at certain time frames. Now every organ has its own circadian rhythm to it. So that's the things that we're looking at. We're looking at how the body makes and breaks down protein. There's a whole bunch of things, other thing that's out there, which has probably a little more question marks behind it, where called telomeres, which is the components at the end of your DNA. We don't know if there's a one-to-one connection there right now, that if your telomeres are longer, that you're going to automatically live longer. That the telomere scientists say is really not proven yet. There's some data out there that says it may. So there's a lot of different things that we're looking at. We're looking at things that avoiding oxidative stress. I mean, I could go on and on all day, but there's things that are kind of that people could control. I mean, that are very easy to control. You don't need lab work specifically. You can, but you don't have to. But you can control by doing a lot of simple things, and maybe one or two complicated things or more complex things really work on limiting. And I mean, people's goal is to live forever. I mean, that we always hear that. I mean, that's the new thing on social media and in lectures now, that you can live an extra whatever blank years, but we'll see how that happens. But
exactly, and especially that, there's always the caveat, well, if we're not going to live necessarily longer, we also want to take more advantage of the time we do have here and be healthier and more vibrant in the years that we do have here. So you did mention sleep a little bit, and obviously it's already common knowledge that we need certain hours of sleep in order for our body to function properly. But if someone comes to you, how do you affect their sleep? What can you do as far as a medical professional to affect their sleep, aside from telling them you should go to sleep early or you should sleep the allotted amount of hours that you need?
I mean, there's a couple pieces to it. I mean, like you said, they're still working on their sleep hygiene. And the main thing we're letting people know now is not sleep is just start at 11 o'clock in a cold room and not on your phone. It starts when you wake up in the morning. That's when your melatonin cycle starts, and all the other hormones, everything from cortisol to testosterone, all those things are kind of a symphony together. So that's where everything starts getting out. So getting morning sun the same time every day. So that's the simple stuff. I mean, that's, again, the things that people can do very simply. It doesn't cost them anything. Again, avoiding where they have caffeine, not eating right before they go to bed, and so on. I mean, there's 8-10 different little tenets of good sleep that everybody would benefit by using. I mean, now then we can definitely add on. There's layers to it. We know that. I mean, again, almost everybody now, not almost there, but a lot of people now have some type of sleep wearable. As we're talking, Aura just came out with a new update. Whoop is coming out with a new update. I mean, everybody's got a new, more and more detailed sleep, and we know that data, as it gets more and more accurate from home, we can see how much deep sleep you're getting, which you need for certain things, for generation of hormones. We're knowing that if you're having these gaps where you're waking up in the middle of the night, or you're not, and that's going to affect how you live. And now a couple studies came out that if you're doing better if you go to bed at 10 o'clock versus midnight. I mean, those are things that, we're working on. So, but depending on that patient's data, you can do more and more. You're going to have to do a deep dive into not only their sleep itself, how rested they're going to be, but we can tell them, are they increased risk for heart attack? Are they increased? We know there's an increased risk from poor sleep and Alzheimer's. Are they going to go deeper down the bad health rabbit hole? So there's the nice, easy things. And then like I know in my patients more and more, I'm saying, okay, let's see what your Oura ring looks like. Let's see what your HRV, which is your heart rate variability, which is every beat shouldn't be exactly the same, the space in between. So we want it to have some diversity. So we're looking at those types of things. We're looking again, and then now there's everything, things like mouth taping. We're knowing the importance of nasal breathing versus mouth breathing. It's great now in the last couple of years that you can go down. Each of these have their own large, deep rabbit holes of 50 things, and patients look at you, and people look at you and like, I'm just overwhelmed. I don't, just tell me. The answer I usually get from my patients or friends is just tell me what to do. I know about A and B, so just tell me the top 3-5 things I should do. And then you go from there. That's what I learn with the patients. You get the parameters. Do they want to do one thing? Do they want to do 22 things? Are they going to inject themselves? Or they say, don't bring a needle near me? And then you can then it gives you a lot of flexibility no matter what.
Something that I have learned from you, and you kind of mentioned spermanding before. Maybe you can explain it to me even further. You mentioned in one of your posts that if someone wants to improve the quality of their sleep, they should be supplementing on spermanding closer to their sleep. Could you talk a little bit about it to make sense, and also talk probably about how much should we be taking?
Let's see, how do I mean, Spermanding has kind of become one of the buzzy type supplements out there. It is derived from wheat germ. The question I get it'll come up is, there are people who are sensitive to gluten that have no problems with it. Something you want to talk about your healthcare provider. But it works. It's what's called a polyamine. It works on a bunch of different pathways. It may increase nitric oxide, which opens up the blood vessels, which helps the brain. It helps bring in anti-inflammatory chemicals. It also decreases anti-inflammatory chemicals by itself. We know that it does certain things, but not definitively how it works. It heals the gut lining itself, the 1 layer, 2 layer thick gut membrane, which people may know more in terms of what's called leaky gut, which gets damaged from toxins or inflammation or stress or whatever. You mentioned sleep. We know because of its ability to decrease inflammation. We know poor sleep could be cause for inflammation. We now know that there are some preliminary studies that it may benefit the circadian rhythm, which I brought up before. That's how we think it may affect it. Plus, it does cross a blood-brain barrier, which again helps the brain function better during sleep. It also may, again, nitric oxide in terms of part of the reason you're supposed to nose breathe versus mouth breathe while you're sleeping as well. So it's probably a combination effect. A lot of things we don't know yet about Spermanding. There are so many studies going. I talked to one of the people really associated with one of the major companies out there. There are hundreds of studies going on, mostly outside the US, on Spermanding right now. And it's a right now, I don't say it's a race, but there'll be so much new data coming out in the next couple of years. Oh, it does this, oh, it does that, oh, and so on. You asked about, in terms of how much to take and when to take it, most patients I recommend now have taken in the morning. My patients who have issues sleeping, I do have them switch to at night. Dosing it's a guessing game at this point. The bottles will tell you to take 1 to 2 pills, which is about 2 milligrams. Some studies have been done up to 60 milligrams without side effect. So to compare that, I know one of the companies is working on on a higher dose pill, because what I'll say is I push dose for my patients after talking to other doctors and the companies that make them. I mean, there's 2 or 3 really reputable companies right now that are kind of the leaders in the field throughout the world, which is great. This is one of those things that's all over. It's not just something that's given in Europe or here or South America. I can say again, without telling patients to do it specifically, gone to about anywhere between 4 and 6 pills, or 4 or 6 milligrams. There's data supposedly coming out hopefully soon to back that dosing up, even even higher. Do not, again, not medical advice. Talk to your doctor, your healthcare provider about how much you should be taking, and read the back of the bottle. It's going to be one of those interesting things in terms of, I think you'll see the dosing recommendations go up and up as data backs it up. The one thing we'll be cautious with is patients who have gut symptoms or especially sensitive to gluten, because then we know now 1 or 2 pills they can tolerate and they don't usually have an issue. When you start going 5, 10 times that dose, are they going to get more risk from taking that much of a dose versus the benefits they may get? It's going to be kind of a seesaw type thing. I know they're making it ironically into a skin cream potentially, because it has a lot of anti-healing benefits too. But that's kind of my recommendation for sleep, is they have them take it right before bedtime. We start them on a moderate dose and we go from there. I mean, again, everything that we're talking anti-aging is what works for you may not work. What works for me may not work for you. And it's kind of it's a puzzle. It's not just here's your antibiotic and you'll be done in 7 days and that's it. It's not that. I wish it was that simple and cookie cutter, but it's not.
Absolutely. So that's definitely a big pillar. As we can see, we can really go down the rabbit hole of supplementation specifically, or how we support our sleep even more specifically. But so if sleep is one of the main pillars, and obviously you did mention exercise, are there things that people come to you and ask you, can you make me perform better during my favorite sport or something like that? Do you get a lot of those requests?
Yeah, I mean, I get a lot of derivatives of that type of either phone call or in office. I want to either just recover better, either from an injury, or after I work out heavy, I want to be able to go back the next day and do something else, or they just want to go from an 8 to an 11. The data is there, the information is now starting to come out. Um, Again, the one thing I would say, just because anybody listens to it, if you are a professional athlete, a lot of this does not apply because a lot of it's been banned by all the government authorities. They just recently blocked a bunch of stuff that we used to use without issue. But yeah, it's a combination. What's great, like I said, first part is definitely, I mean, I'm the US, so I mean, everybody knows Tom Brady here. I mean, he's the poster boy for, I mean, he goes to bed, he has a supplement routine, he has a hyperbaric chamber at home. He makes sure he goes to sleep. His diet is like the most, like, it's very routine what he's eating. Nothing inflammatory, no sugar. So he does. It's all, again, it starts with the basics. What's great is that we have all this data now on patients that we know what their sleep scores are. We know how well they're recovering. We can tell what their inflammation is. We can do brain testing. We can now do reaction testing. I mean, depending, again, how far deep you want to go. And then you also have some basic lab work. We're looking at insulin, testosterone, growth hormone, all those different things that help the patient recover, build muscle, perform better. It's just a whole, again, that runs the gamut. I mean, I'm what's called an osteopath, so I do a lot of hands-on techniques. So having the patients getting fascia work done, and making sure their spine is appropriate and their posture is good, and they're not just sitting here and having like computer neck the whole time. So, or whatever. I mean, it's just, there's so many facets to it now. And then you get into the cool stuff. Again, there's injections, there's IVs that we use. Again, we've used the peptide to help inflammation. A lot of people are into the peptide space. I've heard what's called the Wolverine stack, which is a combination of BPC 157, thymosin beta 4, and CDC, was the growth hormone booster, which are usually given under the auspices of a physician. There are, again, AEDs being used for all the benefits. Again, hyperbaric, a lot of the cool technology that's out there, hyperbaric and sauna. And again, you could just, so many cool things out there. I talked to somebody now who has these cooling gloves. So to the people, they're finding a benefit because the hands and the head are the two things that cool, are the hottest, that if you cool the hands down, they're finding the performance is improved. And that's gonna be coming out very soon. It's like literally every week there's a new thing to play with, or the new thing that people are doing now. So again, like, it goes back to what I said. It starts with foundation. You find out from the patient what they're going to be able to do, what they want to do. Again, some people, like Tom Brady, is going to do 15,000 things, and that's part of his routine, and he's there. There's some people who want one thing, two things, and say, that's it, I'm done. And they both work. So but again, it starts with the lifestyle. The main other part would be make sure you get your sleep, get your recovery down, be it, again, conscious of foam rolling, range of motion, find that something that works for you potentially. And that's kind of, and then you could just go from there.
That sounds amazing. And it also sounds that it's that by having a more advanced measuring and quantification technology, it really facilitates treatment. The question is, it's very easy to understand how you can monitor sleep, especially if you are familiar with wearables such as the Oura Ring or Whoop or any of the other biometric straps that they're in the market. What about things that are a little bit less obvious to measure, such as how our mitochondria functions, or how well we fold proteins? How do you measure those things?
I mean, there's preliminary tests that we can tell a little bit. You can do there's some preliminary mitochondrial testing that we can do that you just kind of have to extrapolate backwards. Part of that's going to be how they respond. If they respond really well to fasting, or they respond really well to cold immersion, then there may be a mitochondrial issue. Again, some of it's still just a guessing game. I mean, like you mentioned, like protein folding, again, unless we know that they're really deficient in all those enzymes, you can tell kind of again in a okay way with what's called either organic acid testing, or you can do, again, like I said, you can start doing NAD testing now. There's some people that test for what's called oxaloacetate, which may have some anti-aging performance. A new small study showed what's called alpha-ketoglutarate has anti-aging and some athletic performance uh, benefits. So you can do those tests. Again, they're not home runs yet. You got to take it with kind of the whole picture and take them with a little bit of a grain of salt. The other thing you can look at is, I mean, epigenetic aging. Epigenetic is how the DNA is expressed. If there's mutations, there's different. That's the whole, again, that's the whole lecture by itself. Is it methylase? Is it glycans? I mean, that's a whole other debate, and people are finding that out too. But you have to take the whole picture and decide that. And again, the other part is just how you, like I said, how you feel. If you feel sluggish all the time and you have muscle aches and you have brain fog and you're obese, there's probably some damage to the mitochondria. If there's damage to the mitochondria, you're probably going to have protein misfolding. You're probably going to have damage to the electron transport chain. It's kind of sometimes you got to go from what they're telling you and work backwards. Again, we know if somebody's diabetic, they have mitochondrial dysfunction. We know if somebody's obese, they probably have mitochondrial dysfunction. If they have neuropathy and so on. So you can do the microscopic, and then you got to go big picture, and you got to just kind of color in between the lines after that.
Very interesting. And you have mentioned a few times, overweight, obesity, and kind of tying it together with peptides. There are a few kind of hot peptides in the weight management side of things, right? I've been hearing about GLC-3, and I've been hearing about 5-amino-MQ1. So what normally do you like as far as peptides that address them?
There are there's a couple of them have gone by the wayside a little bit, at least in the US, because of ruling by our government. But I mean, the main ones for weight loss that are still out there, the one that people talk about is Amlexinox, which works on insulin sensitivity. Insulin's a hormone that helps regulate your carbohydrate. That's a pill which people like. People use BPC 157 because it does improve gut health, it decreases inflammation. We do use some of the growth hormone ones, again, under the regulation of a doctor. They either work or they don't. They work for muscle building. The weight loss part, I've seen patients lose 10 pounds on them a month. I've seen patients not gain anything on them. So they're not as, I like things that I know I can explain to the patient, at least give them, if you do what you're supposed to, you're going to get X expectation out of it. Not that you may be nothing or something. You mentioned 5-amino-1-MQ. That was a rage a couple years ago. It's something that, again, I've seen patients, you got to take it 3 times a day. You have to want to take it right with meals. It's very, very, it is the most expensive peptide out there now, because it's so hard to get. Yeah. It works for some people. If budget's not an issue, it's something you could definitely look into. But it's literally, again, it's expensive. Then you run into things that are kind of the friends of peptides, like what's kind of replaced a little bit, something called semiglutide, which is a GLP-1, which some people say is peptide. Again, it depends on how you want to play with the definitions a little bit, but that has kind of become, again, I know some things out there when patients are asking me about it and not the other way around when I'm telling them about something. And literally I've gotten within the last couple of weeks all these calls about semiglutide, or it's called Wegovy in the US, or Ozempic. And that really works. That's a home run for a lot of patients. The downside is, and I laugh because somebody I know put a post about it saying, yeah, it's great for losing weight, but it also can cause abdominal pain and bloating. And if you got to take the good, you take the bad. And that's true. I've had patients who've done really well with it. I've had patients who say, look, yeah, it gives me a little bloating, but I lost 15 pounds and that's what I want right now. I've had patients who had to stop it within 3 days because they just couldn't tolerate it anymore. So that's one that we're using. I love low-dose naltrexone, which is not a peptide, but plays really well with the peptide population for weight loss. Those are the ones. Then you always can use things like berberine, other things, which are nice supplements for insulin sensitivity. there's a whole, again, there's a lot of other ones out there that we use as add-ons for weight that just don't have the same bang for the buck. And again, if you're paying for something, you want to get the best out of it. So, but that's kind of what's out there right now. Two or three of the products just don't have gone away in the last 2 or 3 years. One is called tesofensine. Used to be a really good product that is, at least in most places now, you can't get. So there's another one I'm blanking on, also went away. So there's a product called tesamorelin, which is really good for weight loss, which now just recently is very hard to get right now. You have to pay out of pocket. It's like $3,000 a vial or something now. So again, if budget doesn't matter, it's out there, but most people aren't going to spend $3,000 every month.
Also, semaglutide is also quite expensive, right? If I'm not mistaken.
If you get it can get approved by your insurance company, at least in the U.S. If it's not approved, people pay out of pocket for it. In the U.S., I've seen anywhere from $700 to $1,100 a month. Their companies now are compounding, which means they're making it in a pharmacy, and that is much cheaper. I've still seen really good effects with it. It just, I mean, again, so there's plus and minuses there too, but it definitely works. And for what the benefits are, just a lot of people, it's worth it.
Understood. Yeah, definitely. And also, I've started following a few researchers looking at how semaglutide plus a ketogenic diet may affect growth of different tumors and how it can help, cancer. So this is very, very exciting if there is any truth to that.
Yeah, semaglutide it's kind of become. What's good about it is it has a lot of other benefits. They may benefit the microbiome, which everybody may have heard of, the bacteria in your gut. It helps fatty liver, with one of the few meds that actually can help treat what's called fatty liver, which is fat development from tons of different things. They think it has some brain effect too, in terms of just normal cognition. It may help Alzheimer's, which goes along ironically with that Viagra. Now, there's a small study so that may help Alzheimer's now, which we kind of had some presumption ahead of time that it may. So yeah, semaglutide is going to be one of those things that's going to be a wonder drug. It's kind of like Spermanding, where as the studies come out over the next couple of years, it's going to be really cool. And that's why I love this stuff now. That the paradigm has changed. We're going down the rabbit hole. You have Jeff Bezos, Elon Musk, the head of Coinbase, all putting money into this stuff. Not Jimmy Buffett, Warren Buffett. Again, it's there. It's going to be prime time pretty soon.
Definitely, and we're definitely starting to hear. I think you and I are witnessing the change of what biohacking was, 10 years ago, when people really raised an eyebrow when you even said the word, and even if you try to explain what you mean by that, that would have even made it worse. To now, where we hear it's going to be a $66 billion market and a few other, declarations, and as far as that goes. And as you mentioned, Young Goose, our skincare company, was just presenting at the American Academy for Antiaging Medicine, which is kind of a mecca as far as our discussion and the subjects of our discussion goes. And since you've mentioned the gut microbiome, there was a very large emphasis there on the connection, what we call the gut-skin axis, the connection between how we look and our microbiome. If it's a very large and reputable company like Microbiome Labs, for example, or a few other companies coming out with gut support supplements, or just supplements in general, which are supposed to affect how the skin looks and behaves. So, Doctor, really, if we can steer the conversation there, if someone comes to you and says, in the end of the day, I'm a vain person. All I care about in the end is how I look. I want to look good right now, the best that I can look right now, and I want to look good for as long as I can. We did mention sleep. We did mention exercise. What kind of other bases are you instinctually looking to address? And what are some more interesting or cool things that you have in your pocket.
Yeah, in terms of skin, yeah, it's definitely still the foundation, the foundational things. Again, we talked about NAD. NAD is now being used. The next big thing are, there's coming a couple of different things. We have stem cells and what are called exosomes or extracellular vesicles. There's a new one called secretomes, which made all kind of little offshoots. What we're talking about is there's, again, stem cells are cells that make other components in your body. Exosomes or the kind of like the little ferries between cells in your body that have huge potential for everything from, again, neuropathy to cosmetic. We use it for hair now. So that's kind of the grand new space. It's pretty much whatever, that's part of it. Wherever we can inject in the face now. There's everything from, again, people are injecting peptides and PRP. The Kardashians made the vampire face where it's just taking your own blood and hoping that you're trying to do all these things are trying to decrease the inflammation. They're trying to help your body, the skin build up and boost collagen. You're trying to now working on telomeres. That's kind of where hyperbaric comes in. And NAD kind of is all those different things, as you know. What was I going to say? Red light therapy has now become, and I don't know if I was talking about this with you or somebody else, was now a debate, do the red light face masks, which make you look like Friday the 13th. Are they too close to make it work, or are you better off doing a panel? But we know red light does have benefit for the face. It's just a question now of how do you do it? And that's kind of the cool part. Now we're debating not if, but how, and how we're getting the nitty gritty down. I love red light for almost everything at this point. Trying to think what else. Again, I mentioned Spermanding before. That's kind of, again, in terms of skin, like you mentioned, again, it's also, again, there's a relationship with the gut microbiome, and now you have a microbiome everywhere. We worry about the skin microbiome. To me, again, I wasn't at the conference. My question is, because I know there's now microbiome bacteria for there's like bacterial microbiome products for athletes. Is this stuff really ready for prime time yet? Is it still kind of just using some buzzwords? I don't know yet. I think that's going to be the next level to me. I want to kind of see more proof is in the pudding type thing. But again, I think you really notice, I guess, other products that work on, there's a peptide skin cream that, again, is working on trying to heal the skin and work it within the skin. I know I keep getting all these emails about all these new products that are going deeper and deeper into that. I think within the next 5 years, it's not going to be as much about the technology that's out there now, like the lasers and this and that. It's going to be about more the things that are actually healing whatever we're talking about, inflammation, working on the mitochondria, working on the telomere, working whatever it's, and then augmenting that with the technology. And then again, that's going to be a component of it. Because but literally every day, I think I get an email or see somebody posting about some new wonderful skincare thing that's out there. The LED lights, the weird face masks that freak me out. Like the tinfoil things. There's so many. It's like how much of these. Actually, something. Last thing I'll throw in there, because again, I'm an osteopath. I'm into like fascial. Getting a facial massage and working on the fascial work and helping your body, your face detox, work on the lymphatic pathways, which is the drainage pathways. Something as simple as that is either free, or a lot of women I do it now too, using what's called gua sha, which is an ancient Asian acupuncture tool, just to get the toxins out of there. Is something you can do at home for $5 or dry brushing, and you don't need to spend $5,000 on your PRP or stem cells. So again, that's why I love it. A, there's new stuff out there. B, you can do stuff at home, or you could go to Manhattan or LA and spend $10,000 on something. A lot of them make sense. It's just a question of what your passion is at this point.
Yeah, I agree with you. I think there are two ways that you can look at sourcing your information. One is really aggregatory. People follow you on as far as what you write or what you post on social media, because there is a lot of information that you can implement from free flowing information. But then there is information that really you should be going, specific information about yourself, about measurements and optimizing your different levels, that you really do need to talk to a professional. So a personal question about yourself: you did mention that you have patients all over the country and really all over the globe. So the question is, can someone get a good, meaningful, result-oriented consultation if they don't see someone such as yourself face to face, or should they seek someone local? What do you see?
No, I think I think they definitely can. I think what I've seen in a lot of cases is, if you, again, depending on how deep a dive you want to do, if you just want to worry about something simple like gut health, yes, you could find somebody local, and you'll definitely going to find somebody good. I've seen so many cases though, because this is it's new, two, it's a little bit complex, depending how deep a dive you're going to go to, and they come in on stuff and they said this would do this, I'm going to do that, and I'm like, and they're like, no, I just felt what? Then it becomes messy. So you're rather off talking with somebody who knows what they're doing. And like I said, with all these things, it's a puzzle, it's juggling. I mean, people may hear the term stacks, which means you want to combine certain things in a certain way to amplify the benefit of all those things. But some of the parts is better than one single thing. You also don't want to do a lot of these things in perpetuity. You want to do things for 3 or 4 months, stop it, add something else. What do I kind of call it? Juggling. You kind of take 2 things out, 2 things in, and then you can kind of get the best of it. So, I mean, I have patients who come in on 35 supplements. They send me their list of supplements, and I'm like, why are you taking this? Oh, I saw it on such and such, or so I saw my friend is taking it. And that's the thing I'll kind of press. If you don't know what's in something, or you're taking something because your friend is taking it, or you just heard of it, if you don't know why you're taking or how to take something, don't take it. Most products are going to cause negative side effects more than benefit you. Because again, your body has, especially when you talk about the hormone type things, because your body has a mechanism. If you're giving something itself artificially, your body's, hey, I have enough of this, I don't need to make it anymore. And then if you don't take it anymore, then your body's like, okay, then you're kind of stuck. So I think if you're doing much, for the people who are more advanced, you definitely want to talk to somebody who deals with it every day, knows the good products, knows how to walk you through everything. That's where you should be going. If you want to talk to somebody about an anti-inflammatory diet, there's great people out there. I mean, there's stuff that I don't know. And again, I know if I have a skin question, I know who to go to. If I have this is such new stuff, and you can't, I do this all day, and I can't keep track of everything. I go to somebody like you, I have my people. I'm sure you have your people. It's like, you don't just go somebody who doesn't know what they're doing. It can cause some harm. That's my long answer to your question, but.
Correct. So and yeah, that was the answer I was really hoping for you to kind of, that was the perfect answer. Especially, I really like the fact that you're saying it's not only what to take, it's also when and for how long. Because even if something gives you a very good, we can talk about fasting. You can fast in the beginning, you will feel great. Eventually, if you don't, take in calories, you're going to die. So everything has their sweet spots as far as when are they beneficial. And I loved your answer. And specifically, Dr. Paulvin, if we can talk about you, because as far as our audience, of course, they're dear to us here at Young Goose, and we wholeheartedly recommend to speak to you specifically. So what would be the process of talking to you and kind of reaching out to you? Yeah.
Yeah, I mean, the easiest way is go through the website, which is drpaulvin at drspelledoutpaulvin.com. Either shoot us an email, the chat box, different ways to do depending on what information you want. The one caveat we're getting a lot more and more is we can't give medical advice over to the chat bot. It's something we got to do in person over with a visit, but glad to give you some general information, things like that. We're going to put some really cool links and videos up as the new year kind of flips over here. Also, my big go through the YouTube channel or check me out on Dr. Paulvin on Instagram. Those are the other two things that they can find more, like some small, quick hits of information, or we're going to be doing some IG lives and things like that after the new year, that kind of really hit all the different components of anti-aging, longevity, sports medicine, things that we talked about today.
Sounds great. And lastly, is it only applicable to the US, or can you give medical advice and kind of direct people also if they're outside of our borders?
Right. I'm actually, it's a very fine line. We can, in theory, give some medical information, but usually most people, for us to really treat them, have to have at least either have a US address, or need to see us in the office one time, either in Manhattan. We'll be branching up to Miami and probably LA over the next year or so, but they need to see us in the office. That kind of makes all the other rules go away. But that's kind of what the rules are now.
I'm very glad to hear that you're branching here to Miami. That would be amazing news.
Yeah.
So again, Dr. Neil Paulvin, thank you very much for this conversation. That was, I think, there were too many bases really to cover in one conversation, and I hope we can do it again. But really, you are a wealth of information, and I recommend, we will put all the links in the description, but I can't recommend enough for people to follow you and to reach out and schedule an appointment with you. So thank you very much for the time that you dedicated to us.
It was coming from you, that I really appreciate it, and it was really fun. It was fun talking about all this stuff.
Yes, sir.